now. So some context, Raquel, can you start with that, please?
Yes. So why are we doing this survey? I guess not many of you here today need the context because you joined, so you're interested, but we thought it's good to just remind ourselves of this vision that has been recently updated. Can you move to the next? Yeah. So that has been recently updated to be even broader, larger than life, or at least as large as life itself. And that's how it also, our survey came about. So we are really striving to everyone with a rare disease and their family members be living their best lives and achieving their full potential. And that falls very much in the scope of this survey. So, and by that, we mean that they should have the support. Fatimata, can we move to the next slide? So that not only their rights are fully respected, but they are fully supported with different support they need in daily life. And of course, that they participate in all aspects of society. So this is very much the core also of what we looked into with this survey. And we do have a position that is from 2019, where a big position paper, which if you have not followed, I recommend, on holistic care. And the third pillar of that was really focusing on equal opportunities and equal rights. And it was really going into the topics around disability and disability rights, independent living, employment, and discrimination, topics you will hear about today in the survey. And we had a question mark about disability for quite a long time. And also it's good to remind ourselves what we mean by it, because you will see different ways in which we looked at disability in the survey. And so just to remind that we are indeed taking an approach of seeing that persons with disabilities are those who have long-term physical, mental, intellectual, or sensorial impairments that in interaction with barriers, so we are thinking of the barriers as well, not just of the impairments, actually become hindered from fully participating in society on an equal basis with others. And this is very much linked to the UN Convention on the Rights of Persons with Disabilities, and it's the approach that we want to take moving forward. And the eternal question on disability is, and we are going to ask you, and I'm going to ask those of you because we've seen the list of participants. So obviously we've discussed the results in advance with our members in order to choose the selected key results. So some of you will know the answer. Please don't answer. Those who know. Those who have not seen the survey results ever, we would like you to answer, how many people with rare disease live with disabilities? Would you say, option 1, it's 4 out of 10. People with a rare disease that have a disability. Option B, it's 6 out of 10. Or option C, it's 8 out of 10. And again, I encourage those of you who already know, members of our Social Policy Action Group, CNA members who are discussing results with us, please don't answer so that we see. Because then Fatimata will reveal what we've learned from this survey, and we can see how much it matches our perception. So I see a lot of you are answering. I'm just going to wait a little bit more than half of you have answered. Come on, come on. If you cannot answer on the poll, feel free to write on the chat if it's A, B, or C for you. And we are going to close. If you did not get your chance, we can end the poll. And let's share the results. So 50% of those of you who responded said 6 out of 10. So I encourage you to stay tuned because Fatimata will tell us what we've learned from this survey.
Thank you, Raquel. Moving along. Okay. So the key finding of the survey. We are first going to start by presenting a Rare Barometer, the Rare Barometer program, which is a Euro survey initiative that aims at gathering people living with rare disease perspective on various topics of interest for the community. We conduct between 1 and 3 surveys a year in 25 languages. And those surveys are accessible to all people living with rare disease and their close family members. So to do so, we rely on the Rare Barometer panel, where I registered more than 10,000 people living with rare disease, living with more than 2,300 rare disease in more than 120 countries. And people do not have to register to the panel to participate. And the survey is also disseminated through social media and patient networks. The result of our survey are shared with participants, patient organizations, decision makers, and the wider public. The information that are collected from our survey is only accessible to the rare disease rare barometer team, and saved on a secure server in Europe. So the objective of the survey on social participation and independent living was to estimate the level of participation in social activity, such as education, work, and leisure, to identify barriers and facilitators in doing those activities, and to understand the preferences and needs regarding living arrangement and personal assistance, to also collect experience of disability assessment, and to identify the main difficulty in accessing social and disability rights. So to shape the questionnaire, we've followed several steps that leads to the one we disseminated during the summer. We conducted a literature review to identify the instruments to use to measure disability, to identify the main determinants of participation, barriers and facilitators, and independent living, to have an idea of disability assessment in Europe, who usually is involved in the disability assessment process, what they are asking for, and how they are doing the disability assessment. Then we reunited with the topic expert committee, a group of experts that help us define priority topics to be considered in the questionnaire. Then the first version of the questionnaire in English was shared with our Council of National Alliances and European Federation, which provided feedback on the language and on the topics and in the questionnaire. And then the questionnaire was sent to translation into 24 languages. The translation was then reviewed by native speakers. So 18 out of 25 languages were reviewed by native speakers. So we ran the survey between July and September last summer, and the questionnaire were available in 25 languages, and the survey was open to all people living with rare disease and their family members, including unsolved case. So we had close to 10,500 respondents worldwide and 9,591 respondents in Europe. So respondents were from 92 countries, and they represent more than 1,700 rare disease worldwide. So today's presentation will focus on 4 topics: disability, meaning how we measure the disability in our survey, and we'll also visit some aspects of disability such as heterogeneity, complexity, and severity. We will also address recognition, disability recognition, notably access to disability assessment and the outcome of the assessment, which will then determine the access to benefits and support, such as personal assistance. Access to support will be addressed as well in independent living. And lastly, we will discuss the level of social participation, meaning school participation for students and pupils, work participation for the working age population, and community participation for the whole survey, the whole sample. So without further ado, we are going to talk about disability. And Those of you who answer 8 out of 10 were right. So 8 people with rare disease out of 10 live with disabilities. How many, Raquel? Answer 8 out of 10?
Oh, I don't remember, but half answered 6 out of 10.
Yeah.
So this is definitely news, new
Yes.
information. To be fair, I've been working with this for quite a while, and even I was surprised.
Okay. So, yeah, 8 people with rare disease out of 10 live with disability. And to make sure that the disability percentage were robust, we estimated using 3 different indicators that we are going to present in the next slide. So the first indicator was the Washington Group short set on functioning, which assesses the difficulty experienced by people living with rare disease in doing 6 activities: seeing, hearing, walking or climbing steps, remembering or concentrating, self-care, and communication. And each level, and each of those domains is coded no difficulty, some difficulty, a lot of difficulty, or cannot do at all. And per this instrument, 47% of people live with rare disease, meaning that 87% of people living with rare disease in the survey have some difficulty, a lot of difficulty, or cannot do at all at least one activities. The second indicator we use is named the Global Activity Limitation Index, GALI, which measures disability through activity limitation that an individual has experienced in the last 6 months due to a health problem. And per this indicator, an individual with some or several activity limitation is considered as living with a disability. And with this indicator, the disability rate is 83%. And lastly, we ask people directly if they consider themselves as living with disability, which is a self-declaration. So people will ask to declare if they perceive themselves as living with a disability, an invisible disability, a visible disability, or both type of disability. And when we use this indicator, 8% of people living with rare disease consider themselves as living with disability. So we use these 3 indicators to say that 8 people out of 10 live with a disability. So people living with rare disease have a disability in all those 6 domains in the survey. So meaning that they have some difficulty, a lot of difficulty, or cannot see, hear, walk or climb steps, remember or concentrate, take care of themselves, or communicate. Disability can also be invisible. We consider that 70% of people living with rare disease have an invisible disability, which means that 45 have one disability that is invisible, and 25% have 2 or more disability, and one of them is invisible. So the consequence of having an invisible disability is that it can be disregarded and not taken into account when you are undergoing a disability assessment, for example. Which is exactly what we see in the testimony about having a disability that is invisible and undergoing a disability assessment. We also found that the percentage of people experiencing pain and fatigue is 80%, and it is determined by the frequency with which people experience pain or fatigue. It can be some day, most day, or every day. And that was measured with the extended version of the Washington group short set. We found that there is a positive relationship between the nature of the disability, meaning visible or invisible, and the pain and fatigue experienced by people living with rare disease. So around 96% of people living with invisible disability experience pain or fatigue at least some days. Disability can also be progressive uh, or progressive or dynamic. And most people with rare disease have a disability that is transient, meaning it can vary over time or worsening over time. And that concerns 64% of people living with rare disease. The disability can be multiple, can be complex, it can be multiple disability, it can be accumulation of disability. So 72% of people living with rare disease have a difficulty, some difficulty, a lot of difficulty, or cannot do at least 2 activities. And it's the case for 53% of people living with rare disease when we consider 3 activities, and 35% accumulate 4 activities or more. Accumulate difficulty in 4 activities or more. And disability can also be severe. We make a difference between a complex disability and a severe disability because when we talk about complexity, we're just taking into account the number of domain in which people have a disability. While when we talk about severity, we consider at the same time people, the number of domain in which they have difficulty and the level of difficulty. So while the complexity will just consider the accumulation of domains in which people experience difficulty, the severity is defined not only by the number of activities or domains in which people experience difficulties, but also by the level of difficulty. So what we do is that we attribute a score to each response choice for each question of the Washington group. Then those scores were added up throughout the 6 domains, and we obtained a total score per individual. So the total for each individual ranges from 0, which is no disability, to 216, which is cannot do any of the 6 activities. So depending on the level of score, each individual is assigned to 1 or 3 categories. So you have more disability, moderate disability, mild disability, and of course, no disability for people who have a score of 0. So individual with 4 or more functioning domain coded with a lot of difficulty, or with any domain coded cannot do at all, were labeled with more severe disability. It is the case for the 7% of the population. So they have a score which range from 24 to 216. So someone, let's say, who cannot hear at all, have a severe disability, but someone who have who have a lot of difficulty in 4 domains or more has also a severe disability. And disability recognition. So for people with rare disease, their disability are not adequately recognized because it is not provided to everyone. And as we know, disability assessment is often the first step to obtaining recognition and accessing social rights and supports. So what we notice is that they will have difficulty entering the system, meaning that they will not have access to disability assessment in the first place. And it is the case for 15% of people living with rare disease who did not have access to disability assessment. Also, they needed one. And the other barrier to recognition occur at the end of the disability assessment when people with rare disease don't have the outcome they expect. So it was the case for 1/3 of people with rare disease who had a disability assessment. And the reasons for that are diverse. Most of them think that they were given a lower percentage or grade of disability assessment than expected. For 52%, it was because they think that their needs were underestimated. And for 25%, it is because they did not obtain the recognition for their disabilities.
And here it's also interesting that we asked an open question in the survey about what went wrong and what went well and what could be improved with disability assessment. And we are still reviewing those stories, over 7,000 of them that were submitted. But we see that, so you see here that 25% did not obtain recognition. So we could see the others will have, we suppose. But in the stories, it comes that various people talk about having had to appeal and having had to go 2 or 3 times to a disability assessment until obtaining a recognition. So this is something we are seeing from the stories, and which is an interesting insight, that the number here doesn't tell everything, doesn't tell the full story.
And also independent living. So after the disability assessment, we notice as well that we notice as well that 16% there are still people that will undergo a disability assessment, but will not have a full access to social benefit, even if they have maybe the outcome that they expected. So 16% of people with rare disease who had a disability assessment were denied access to support, while 47% only had patient support. So this concerned only people who had a disability assessment, as I mentioned earlier. Sorry. But overall, when we consider the whole sample, meaning people who had disability assessment and people who did not have disability assessment, we found that 53% found it difficult or very difficult to obtain publicly funded support. And the 3 main reasons are, first, that because of a complex and lengthy application process, then because of the fact that their disability were not considered severe enough, and lastly, because they lacked information about the application process. And most people with rare disease who need personal assistance did not access one. So personal assistance is one of the pillars of independent living. It refers to a person-directed or user-led human support available to a person living with disability. So most people with rare disease who need personal assistance did not access it, mainly for 3 reasons. Because they were not meeting the requirement to have one, because the application process was unclear, and lastly, because the country or region they live in does not have personal assistance, does not have the service at all. So 62% of people with rare disease who need personal assistance do not have access to one, against only 38% that have one and that need it. Social participation. First, discrimination. We notice that people living with rare disease experience discrimination in various domains, especially in public accommodation, in healthcare, in education, in healthcare, in public accommodation, in education, in employment, and 6% in housing, 1% in social environment, meaning family and friends, and other. And further analysis shows that there is a negative impact of discrimination on work and community participation. When we consider only children and adolescent participation, meaning participation in school, for example, we notice that 79% of children, of students and pupils do not have a full participation at school. So we measure the school participation with the children and adolescent scale of participation, which measures the level of participation at school in 5 subdomains: educational activities, recreational activities, mobility, use of educational material, and communication with others. And there are 4 levels of participation: full participation, somewhat limited, limited or unable, or not applicable. Each level is attributed a score, which allows us to calculate a total score for the 5 subdomains. And the score will vary between 0 and 100, with 100 being corresponding to full participation. And depending on the value of the total score, people are assigned into 4 categories: very limited. Here it is the case for 25 people, 25% of students. Limited, it is the case for 23, somewhat limited 31, and full participation concern 21% of students and pupils living with rare disease. So 79% of children, of adolescents and children have a limited to somewhat limited participation at school.
As you can see, this is a very sophisticated way to measure school participation with several variants then combined in a score. And I think it's the first time we actually have evidence on school participation for children and adolescents with a rare disease. And in the stories, mostly given by family members in this case, we also see situations of telling us that there are no services at the school, that there is no way to be accompanied at school. And so some of the barriers are also told to us by the stories that we read from this open question.
And as to work participation, it is assessed first by the level of unemployment, and then by the involvement of people who are employed. So firstly, 23% of participants are unemployed, which is almost 4 times the unemployment rate of the European Union in 2023. However, we do not measure the unemployment rate the same way as Eurostat does. So while their methodology can be more complex than ours, we determine the percentage by asking directly to participants if they are unemployed, employed, or what is their current situation. If they had to choose between being employed, unemployed, being a student, being a stay-at-home mom or dad, etc. So the unemployment rate is therefore the percentage of people aged 16 to 64 that answered unemployed to the question, what is your current situation? So it was just a disclaimer for the comparison between our unemployment rate and the one of Eurostat. But it remained really high compared to the unemployment rate of the Eurostat, the European Union in 2023. And the other way in which we try to measure work participation is by asking respondents who are in employment how they are involved at work. And we found that 36% have a limited participation, meaning that they are very limited when working or somewhat limited when working.
And although we cannot present everything today, There is more information that you already will find available in the dashboards and later on in the report on also facilitators to employment and different things that people appreciate in terms of workplace accommodation. So we chose a selection today, but there's more in every of these areas that you will find on the dashboard already and later on in the report.
And now participation in the community. So community participation was also assessed using the children and adolescents scale of participation. Even if it is dedicated to children and adolescents and young adults, we apply it to the whole sample. And exactly as, similarly to school education, school participation, the CASP will measure the level of participation in 4 community subdomains, which are social play and leisure activities, structured events and activities in the neighborhood, moving around the neighborhood, and communication. So there are still 4 levels of participation, or 3 besides not applicable, which are full participation, somewhat limited, and limited or enable. Each level is attributed a score, which allows us to calculate a total score for the 4 subdomain. And as with school participation, the score will vary, will range from 0 to 100. And 100 is full participation. So we can assign people living with rare disease in each of those these following categories. Very limited, which is for correspond to 36% of people living with rare disease. 21% of people living with rare disease are limited, and 27 somewhat limited, which is which correspond to a high level of participation restriction in the community for people living with rare disease. So the results, some of the results of the survey can be quite alarming, but there might be a silver lining in the level of social support we experience in our community as people living with rare disease. So the level of social support demonstrates this. And by social support, we mean the support received from people, close people to count on, concern shown by other people, practical help from neighbors in case of need. And 77% of people with rare disease have a strong to intermediate level of social support. And you will see in the report that further analysis will show that social support is a very strong determinant of school participation, work participation, and community participation, meaning that having an intermediate to strong social support will likely increase school, work, and community participation.
And so we cannot say for sure. We cannot always, I'm always careful in what I say so that Fatoumata and Jessie, they look at me to see if I'm accurate, but we cannot say for sure how things are. But here, as Fatoumata said, it's a silver lining. And on the other hand, there's a reverse coin of the silver lining. So we are very strong within our community and within our families and within our close ones to provide support. The reverse coin is that probably because there is an absence of support. So it's everything is possibly related in that sense. And so it's also at what cost, a reflection for us, not a result of the survey, is that at what cost, right? Because then we get a lot of support from our own close ones, but that probably also has a cost.
And now I let Jessie tell you more about how what this will provide in terms of resources regarding these results.
Thank you. I was actually wondering if maybe because there's been a few questions already on how we can access the results. Okay. But I was wondering already if you had any questions or any remarks on the results themselves. We've been through quite a lot of figures. We have seen some quite compelling results too. So I don't know if any of you has any remarks or questions on those results. Some of them being quite not so much complex, but we did use some indicators that are being used most of the time to measure participation or disabilities in several instances, and that may not be as direct to understand as a simple question with modalities, but so you may have some questions, and I see that Vicky McGrath has raised her hand. Vicky?
Thanks, Jesse, and thanks, Raquel. And sorry, I don't know the name of the other person, but great to see this coming out. I was just wondering, just in terms of the disability, I'm like 8 out of 10. It's like, oh, that's very high. Do you know, do all of the countries that participated, or I guess maybe even just the countries across the EU and Europe, do we have the same definition of what disability is? So that if I go out and say, 80% of people living with rare diseases in Ireland have a disability, is that true, or should it, would it be different because I'm in Ireland?
I don't think that it would be different because you're in Ireland. The percentage or the rate could be different. But we ask the same questions everywhere. And you see that actually the reason why we asked, we had 3 indicators is because there are different definitions of disability. Maybe Raquel, you want to come back on those different definitions and what it entails?
Yes, so we, and maybe Fatoumata, you can take us back to the slide on the indicators. So there was a lot of discussion with the topic expert group on how would we try to assess this and what kind of instruments we could use. And so we made the choice to, and we even discussed which one will we choose, just one. And then we made the decision to use 3 because we wanted to kind of have several ways of seeing so that, and so one of them being this Washington Group CET, which is an international questionnaire that has been developed and extensively discussed. And so it really focuses on certain activity limitations. So we could say certain impairments, and it focuses on the difficulty with those. So the way the questions are phrased, go, do you have difficulty seeing even wearing glasses, for example? Or so it tries to get a little bit into the barriers, but it doesn't get that much into the barriers. The second one we have used, and so as per that one, it was 87%. So again, in Ireland, you would have the answers of the people based in Ireland to these same questions. And then the second one is the Global Activity Limitation Index, the so-called GALI. And the reason why we have used that one is that Eurostat uses that one as a measure of disability. It's also a bit criticized and a bit falling short for us because, as you will see, it points to during the last 6 months, it kind of conditions you. So for people whose conditions vary, it could be that actually their answer is influenced by that and maybe they were feeling better in the last 6 months. And it is about being limitation in activities, in performing activities that people usually do. So that's how it's defined because of a health problem. So it points to your health. And here it's a community living with a rare disease. So generally people will have a rare disease, so they have a health condition, but it's still health based, but it refers to activities. So it tries to mix a little bit both health and barriers. So potential impairments and barriers. And the third one, the self-identification, we really asked, do you consider yourself a person with a visible disability, an invisible disability, or both visible and invisible? And here, some people might be thinking of their impairments. Some people might be thinking of everything and the barriers I'm finding and how my pain, for example, which maybe I don't think it's an impairment as such, but it makes that in interaction with society, I am disabled. So we use the 3 of them across all the countries. So what you will have for Ireland is the results of the respondents in Ireland. and for other countries similarly. And that's why we use 3 methods, all resulted collectively across all countries in Europe above 80%. And it gives us a bit more robustness to say that it's 8. It's more than 8, in fact, as you can see, out of 10.
Great, thank you.
Yeah, it's true that we didn't base or we didn't rely for the questions, for the way we phrase the questions on the way disabilities or disability assessments were defined in each country. We didn't adapt the question to each country, but we made sure also that we could not only compare with other populations, so you're using the GALI, but also making sure that we do see or measure disability rates in a way that is really robust. And so I see other questions in the chat. Did we differentiate between types of social support in the analysis? Social support in neighborhood, from families. So regarding social support, I may leave it to Fatoumata and Raquel to answer, but we mostly grasped social support through the questions that we presented. Maybe Fatoumata, you can go back to the questions on social support. Again, using instruments that exist elsewhere and that were developed in other places, so that we could compare and also ensure the robustness of the results and that they're recognized.
Yeah, actually, it is an adaptation of a question used in the by Eurostat in the Silk to measure social participation, and it is a whole. We did not make a difference between neighbor, family. We just talk about social participation. Social support in general.
Thank you. Yes, actually, I was talking about, I was referring more to community participation and not so much social support. And I was.
Was it the question about social
No,
or
actually,
community?
I was
okay, sorry.
not
I
exactly
thought.
answering the question.
Okay, sorry.
And I see that there is an answer to Vicky in the chat. So Kirsty Hoyle is saying that in the UK, many disabled people use the social model of disability and therefore would not say that they have a disability, but rather that they have impairments and are only disabled if not provided for. So the language used in this project is from a more European context, which is worth considering when translating the results for a different audience. And also there is the issue of ableism to contend with. Someone with a rare disease and attendant issues such as mobility issues may not consider themselves as disabled due to social issues or their community context.
Mm.
It's true that one thing that we didn't present here, we started to look into it, but also won't go too much into details into this comparison. But having 3 indicators to measure disability among our community also allowed us to try and see how many respondents were considered having a disability in 1 or 2 or 3 of these indicators, and especially when we looked at self-identification. One of the discussions that we had with the topic expert committee was also to wonder if self-identification, those who self-identified as having a disability were the ones also that could be identified as living with a disability with the other 2 indicators, so the Washington group and the GALI.
And you are right, Kirsty, when you say the issue about ableism and also people who might fear stigma or simply an identity issue. So in the report, you will find actually that Fatoumata has done this crossing already. And there is, I don't know if they allow me to say the figure. I'm just looking at them because I have the report in front of me. Can I say it?
Yeah.
Okay. So, and we've seen that 29% of people who did not consider themselves to live with a disability had functioning and or activity limitations per the two other instruments. So they didn't identify in the question on self-identification, but they actually ticked positive on the other indicators. And of those who declared they had a disability, 17% were actually not ticking on the other instruments. So this could be people who suffer from, who live with extensive pain, for example, because as you've seen, the Washington Group survey looked into hearing, seeing, communicating, self-care, but for example, did not look into pain or fatigue, which can be very significant elements there. So we could, that's one reading we can have as to why this happens. But indeed, they're both situations, and that's why it's also interesting to have three indicators so that we can see these potential crossings or differences in self-identification too.
Thank you, Raquel. Are there any other questions or comments also on those results? I see a new comment in the chat. Also from Kirsty, saying that this survey is a great starter for 10 as proof of concept for more research. So excited to see this develop. Yeah, the 27% that Raquel just talked about are interesting. Three indicators is such a clever way of layering up declaration and how it might link to self-identification. Thank you. So we can maybe now move to the results and how we make them available. Oh, did you measure the impact of disability on the caretakers? So what I can say, actually, so that's why I was going to go to what is available already and what will be available, because as you may have understood from our from the way we talk about the report, it's not completely finalized, and that's also a good occasion to get your feedback and see if there are some aspects that we could go more in depth into in the report. And actually, it's true that we do have the possibility to differentiate between those who answered as living with a rare disease themselves and those who answers as family members. We didn't ask a question specifically on the impact of the disabilities that people living with a rare disease have on their family members. However, we can use this difference between people answering for themselves and family members to see if there is a difference in the way they answered. And that's something that we can go a bit more into in the report, but we didn't ask them directly. However, we can always look at, for instance, community participation and the difference between people with a rare disease and their family members, and see if it has an impact when the person living with a rare disease is also living with a disability.
And so just to complement, we decided to focus on this survey. A lot of the questions are about the situation of the person, whether that's a child or an adult. So the person who lives with a rare disease directly. And that choice was also because the previous survey, the first one that we did with Rare Barometer survey, looked much more into the situation of the families, the time they spent on care, and different things related to the support that the family provides. So here we made a choice to see the other complementary side, and we can still use, of course, the other survey is now a bit older, but we can still use that data in complement to that. And to complement Jessie's point, you will see in the report that Fatoumata did extensive analysis sometimes in the perceptions, especially when the indicators around the participation of children and adolescents, depending on whether it was themselves who answered or the families, whether they were leaning more towards something positive or negative. And you will find some insights into the report later, because that's a thing we were wondering indeed, because sometimes it's not the same perception around your participation for a child, or if it's the parent, an adolescent, or if it's the parent answering. Same for living arrangements. If you are answering yourself, there's a certain perception you have if you are answering on behalf of your child or your adult person with a rare disease who did not answer themselves, you might have different perceptions. So there's been a bit more that Fatoumata has been digging into that for the report.
So actually the next question in the chat is about the availability of country results, which is the next part. So I will talk about that now. Actually, first, maybe the European results just before. So you have the fact sheet available. You will recognize in the fact sheet that is available again on the link that I shared in the chat before, and that I can reshare now. You will find the figures, some of the figures that we presented today. So they are directly coming from the fact sheet. To also answer one of the questions that was in the chat, please don't hesitate to use some of the figures from the fact sheet. You can even have screenshots from the fact sheets, use it as an image to include it into your presentation. Please just say that this is coming from a Rare Barometer survey because, well, that's a lot of work, but also because then people can go back and see how we built this survey, how we designed it, and also see that it is really robust. So I think it does bring a sense of robustness now when we talk about Rare Barometer, at least for those who know the program. So we have conceived this fact sheet for each figure and each box to be able to be used as a standalone figure in your presentations or whenever you need it. And so we have a fact sheet with 4 pages in English, and very soon we will make available a 2 pages long fact sheet that will be translated, at least in the 7 languages of Eurodis and in other languages on demand, and with also key results. And then we also have made available the dashboards with the European results in the 25 languages of the survey. So if you click on the link that I shared, they're all available now in the 25 languages with the answers to each question of the questionnaire. And so if you click to the next, if you go to the next slide, as you know, and we can see now that it's quite well understood and quite expected, actually, the tailored results to Eurodis members and to the ERNs. So each Eurodis member, as long as they have enough respondents to ensure anonymity of the respondents, which is usually around 30 respondents, can have access to their results. So we will send very soon, either next week or the following one, the results to the Eurodis national alliances, also the European federations with more than 30 respondents, and European reference networks with more than 30 respondents. And for other Eurodis members who would like to know if they have enough respondents and if they can receive the results, but also who want to receive the results, you can just send us an email to rare.barometer@eurodis.org, and we will answer you as soon as we can to let you know if you can access the results and with your own results, if that's possible. So when we say that we I have a question on the dashboard. Is it possible to download the dashboard as a PDF or to download our national dashboards as a PDF? Yeah, so that's something that we can do. I will come back to that a bit later. Actually, when we send you the results, you can always ask for a PDF version of it. It's actually for us to export it into PDF. But yes, I will come back to that just in the next slide. So when we say that we adapt the fact sheet, if you go just before, so when we say that we send you your own results on the fact sheet, it means that we adapt each figure? Would it be the number of respondents, the country or disease where, well, your country or your disease or group of disease, and we adapt each figure to your community. And for the dashboard, so what we send by default, let's say, if we could go to the next slide, is the online dashboard. So it's an interactive dashboard where you can change pages, have access to several languages, to the 25 languages. Most of the content is translated. Some of the content is only in English because that's something that we added after the survey was closed. So we didn't translate everything, but for instance, here on that slide, on that page, the description of the 3 indicators that we use to measure the disability rate is only in English, but you can easily copy, paste, and translate it. And then you have access to all the questions as they were asked in the 25 languages and the modalities for answers in this online dashboard. And then to answer Eva, yes, we can export a PDF version. We can even export an Excel version of the dashboard, but that's really on demand. That's not something that we can do by default, but if you need one, we can definitely create one for you. If we go to the next slide, that's actually, I think, what we're talking about. So if you have a specific request, you can send an email to rare.barometer@yourdis.org with the name of the country, the languages that you would need. Would it be, so for the PDF version of the dashboard or for the fact sheet, and the type of file for the dashboard, so online, PDF, or CSV, so to open in Excel or similar softwares. For European federations and ERNs, the list of ORFA codes, well, for the ERNs now we have most of the list of ORFA codes corresponding to the ERNs because the ERNs shared them with us. Also the languages needed and also the type of file. And for other EURDIS members, please let us know if you need which country, well, the figures and results for which country and which ORFA code. So we always rely on ORFA codes. That's something we can work on together if you don't find the ORFA codes. But in our system with more than 6,000 rare diseases, it's important that we can rely on the ORFA codes. And then I see a question in the chat. So actually the members are the EURDIS members. So I can send a link to the webpage where we explain what are the conditions to become a EURDIS members, but that they are really the EURDIS members. And then regarding the companies, actually I can also send in the chat the link to the webinar that we had a few weeks ago on the results of the diagnosis survey, because we have example of how some companies helped some patient organizations that are members of EURDIS to access their results so that those results can be presented in an event that was sponsored by that company. And also so that those results can be taken into account internally in the company. So yeah, while we look at the number of respondents per country so that you also have an idea of how many respondents there are in your country and which countries can have access to their own results, I will also look at the membership for EURDIS and just copy the link in the chat. And then on the next slide is the number of respondents in the world, because we have presented the European results because most of the respondents are in Europe, and we mostly use those results for policy and action in Europe, but actually people can answer from anywhere in the world. And again, EURDIS has members across the world, and those who have enough respondents in their country or for their disease, even if they are outside Europe, can have access to those results if they send us an email at our Rare Barometer email address. And then we have the number of respondents per therapeutic areas. You will have everything not only in the dashboard, well, you already have everything in the dashboard that is online, but you will have it in the presentation that we will share after the webinar. The number of respondents then per ERN, with almost all ERNs having more than 30 respondents. So all of them will receive their results by default. And now what's next? So what's next is that we now need to finalize the report, which is almost finalized, but we wanted to make sure that it is a final report and that we can use for years, because we've seen from the Juggling Care and Daily Life survey that those reports have been used for several years. So we just really want to make sure that we have everything in there that you can use, and we will definitely use the questions and the feedback that we had today to make it even more complete. And those results will be used in our own advocacy.
Yes,
And
and
this
that's
is
why that's why the report, I must say, I'm the one also pushing for the report to be very complete, because we've seen, as Jessie said, that we need certain information for certain particular discussions. So do know that we presented a selection of results today. Do stay tuned for the report, because there is much more there, for example, on personal assistance, but also on employment, on where you live and where you would prefer to live in terms of your living arrangements and housing. So there were things we could not bring here today, but which are relevant in your own context and in our context at European level to discuss with policymakers. So for us, it was already a priority before. It's even stronger now, that we really want to fight for everyone with a rare disease to have adequate disability assessment and the recognition. We've seen if it's 8 in 10, there will be 2 who don't need it, but the other ones. And everyone should have access to adequate social and independent living support. And so we'll continue to fight for that. And in terms of concrete actions that we have, obviously, we're going to now raise awareness. I think it's the first time we have such strong and with such high number of respondents and such a diverse number of respondents, that we have these elements on social participation, but also on disability and on different barriers. So we're going to be hammering that into every stakeholder that we engage with as much as we can. And in terms of European level, there is going to be this year the review of the ongoing European strategy for persons with disabilities. So that's until 2030. There's a midterm review this year to propose new actions for the next period. And we, as a member of the European Disability Platform, one of the civil society engaged, are going to be certainly using the data from this survey to ask for things, notably on disability assessment, which is something that everyone always wants to avoid. It's a tough discussion to have, and it's one that we are always pushing. And we are very lucky to have been granted a slot at the next plenary meeting of the EU Disability Platform. So that's all the member states sit there, all the ministries of social affairs or other ministry responsible for disability rights sit at that meeting, and we will have the chance to present the results, slightly different from today, because we're also thinking about what the strategy is covering, what are the current discussions. And so we'll make the best use of that. The other thing is that some of you will know that there's been a directive, an European directive approved last year for the establishment of a European disability card that would allow people with disabilities to have recognition when they travel abroad, and which also means you would have in your country, because you have to get it to then use it when you go abroad. And for us, it's very concerning that we see there's significant issues with recognition, because it means a lot of the people might not get this card at all. So and that's a very hard discussion to have, and now we have so much more evidence to give to it. And the last thing is on independent living, and that's and community-based services, and that's also why the report is so much more extensive, because some of these things are very not black and white, and it's really good to understand as much as we can the perspectives that we collected on how people wish to live, on how they are living, on who is in institutions, is it many people, where do they prefer to live, and because these are difficult discussions to have, and decisions will be made where funding goes and does not go at European level, and we want to be sure that we are protecting everyone within the community. You've seen it's very diverse, so we'll have people with very different types of disabilities, and we will have people with very different needs, and we will have people with very severe disabilities, both children and adults. And so we need to be learning as much as we can from the community to really protect everyone in the discussions that are being held at European level. So that's what we plan to do, and we encourage you to do the same at national level. For those of you who are members at national level, the European federations, or at your disease level if you are working at a more disease level, and for partners of Rare Barometer and companies to take this into account as well when you are reflecting on your own mission and the value that you bring in as a company working in this space.
We see that Eva has her hand raised.
Yeah, hi, thank you. I just wanted to ask you and tell you, we were considering sending out a press release for Rare Disease Day where we would focus on the results of the survey, because we know the press always, we can capture attention with figures, and we were now looking to see in our Belgian community for testimonies that can complement the figures. But yeah, I was just wondering how you feel about us doing that right now, because of course we won't have been able to have more of a in-depth analysis of the report might not be ready, the full report. So yeah, I just wanted your feedback on this idea.
So what we can do is that actually what takes more time is to adapt the fact sheets. But what is quite easy to do is to send you the dashboard for Belgium, for instance. So if there are some specific queries, especially for Rare Disease Day, given that it's coming quite soon, we can share. And actually, we do have a press release, so in English only, but that you can quite easily translate, that has been published today. So you can always use that press release. That's about the European results, but we can also, and we can do that, and we can remind it to the CNA and CEF members, so the National Alliances and European Federations, that we can always send at least a dashboard so that they can have access to their own results. And if that's just for, if you don't need the fact sheet now, and you still want to have your results and be able to take the main figures, please don't hesitate. Nothing is under embargo. I know that last year we had a whole embargo thing because of the peer-reviewed publication linked to the diagnosis survey. That's not the case anymore. It's just making sure that it's all well done and that we can use the fact sheet and the report in the upcoming years. But if you need faster access to your results, we can just, you know that we just need to filter the results by country or by disease or groups of diseases and send you the dashboard, and that's quite fast for us to do, as much as we can just take all the queries between Fatoumata and I. That's it.
Okay, we have our dashboard, so that's perfect, thank you. But it would be really great to also maybe be able to make use of the report, not for dissemination, but just for our own information, to be well prepared if we would have interviews coming up and stuff like that. But I will mail to you to put the question again.
Okay, and we can always catch up also together if there are anything that you want to discuss with us, that we can arrange a meeting also.
Thank you.
And with any other member, yeah, or non-member. This is an open webinar, so yeah. Okay, I think that then we still have a few slides actually on how we can, or how you can communicate about the results. So first of all, you can promote the European results using the link that I shared already in the chat. Once you have your community's results, you can share them on social media, and please, again, try and use the hashtag Rare Barometer. when you have a fact sheet, so either with the European fact sheet in English or when you have your fact sheets, you can use them in your web pages, in your advocacy efforts. Again, you can copy paste the figures very easily. We try and make sure that they are nice and can be reused quite easily. You can repost, share, or retweet all the content that is coming from the Eurydice account, and that will come very soon on the results themselves. And you can also add your organization's logo for your community's results. Of course, there's no issue with that. And then, so you can also, of course, make your own analysis or publication. This is something that people are now more used to doing. For that, you can access the specific results through your Eurydice members. And you can also contact the Rare Barometer team to ask for tips or to be co-authors of publications, which just makes me realize that I didn't share the link to the recording of the webinar on the results of the diagnosis survey that I talked about just earlier. So I will do that very soon. And if you realize that you don't have enough respondents for your results to get your own results for this survey, well, I'm afraid that for this survey, it is quite too late. You can always reuse, and we always give access to the questions that we ask in the questionnaire. So you can always redo your own questionnaire and redo your own survey if you want to have more respondents and see what is going on in your community. And we do also give access. We have developed resources for patient organizations to conduct surveys or reuse all the resources that we have developed within Rare Barometer. And but you can also spread the word very soon about our upcoming survey, because actually to ensure participation, you just need to make sure that enough people participate in the survey while it's open. And actually, the next slide, you all know about it, so I don't think that we need to go back to it. Are there any other questions remaining? I will try and share the link to the recording of the webinar of the diagnosis survey. Here it is. Where you can also have access to the slides that were shared during the webinar. So I guess that's it. We just need to. So the minimum number of respondents, Vicky, is usually 30 respondents. We just don't write it everywhere, because sometimes if we can ensure the anonymity of the respondents, even when there are just 25 of them, we still share the results. So the threshold is usually 30, but we always make sure that even if it's 28 and anonymity is ensured, we do send the results. So we just need now to thank you all again for being part of this webinar, but also you were all, I guess, part of the dissemination effort of the survey, or partners of Rare Barometer, and then helping us every day to conduct the surveys and analyze the results and make sure that they are available to everyone in the community. So thank you very much to all of you. Well, the next phase will be to talk about the next survey on well-being and quality of life. So we will reconvene in March, not only for the reports on this survey, but also on the next one. So thank you very much to all of you.
Thank you, everyone. Bye.
Thank you.
Bye.
Thank you.
Thank you. Bye.
Thank you all. Bye-bye.
Thank you. Bye.
Bye.